our physician community in the US and around the world play a valuable role in designing and directing care for individual patients. And by the way, when we speak about the word trust, in the US, 81% of people who might not trust anything they hear on TV trust their doctor, right? So we're not speaking about replacing physicians. We're talking about making care more accessible to people where care is not as easily accessible, and allowing all healthcare providers to operate at the top of their license. And that's really the goal that we have. In places like in rural America, you don't often hear about healthcare in rural America where hospitals are shutting down and it's hard to access care. People have to be flown to get, if they're having a heart attack or a stroke, to get care in the nearest city. We have to find new models and new ways. And when those models are built effectively, care does not suffer. We've seen that as an example during the pandemic with stroke care in the United States. At the American Heart Association, we've spent 20 years building stroke systems of care, building primary stroke centers, comprehensive centers where appropriate care can be delivered, thrombectomies and TPA administration, changing laws in communities so people can be transferred to the right hospital. And during the pandemic, in papers that we will soon publish, you will see that the stroke system of care was there to support people who had a stroke during the pandemic. All of these things matter when we get back to the individual patient.